So I think the message, if there's nothing else one learns from this, is that this is an exploding field. There are multiple new drugs which have just been approved by the FDA this past year or so. We are learning how to use them. We are much better in inducing patients into a complete remission, or at least into what we call a very good partial remission, essentially eliminating at least 90% of the myeloma load when they present. And as a result, and that's the primary goal, we can then take many of those patients to an autologous stem cell transplant, provide consolidation or maintenance, and the goal is to accomplish what we call a minimal residual disease, or even lack thereof. So we can pummel the disease into non-visibility. That will directly translate it to longer survival. And the quality of life accomplished after getting a patient into remission and their life expectancy have dramatically improved over the past decade or so. So the message is, if you have a patient with multiple myeloma, you have to be aggressive. You have to use the latest available medications. If there are clinical trials which would be suitable, that's highly recommended. Because of the fact that now several randomized studies prove that the item of autologous stem cell transplant needs to be right in the middle of the treatment repertoire. Patients need to be referred to a transplant center early, and there's an absolute need for maintenance therapy because it has been proven that it provides survival advantage. So bottom line, the prognosis is much better. It's not the disease we used to deal with 20 years ago.